My name is Julie Auber. I am in the Department of Kinesiology and Public Health, and I'm also presenting here on behalf of my colleagues, Dr. David Askey from Communication Studies and Dr. Hunter Glanz from Statistics Department. We also had two wonderful students, they're undergrads, Anna Estrada and Erica Martz, who actually analyzed all of the data for us. We're both in public health. So today I'm going to be taking you through, this was an exploratory study to inform a larger survey that looked at the reported impacts of COVID-19 on health and health behaviors, as well as individuals' trust in social media for COVID-19 information. So I really want to spend a lot more time on the results. So just briefly, background, we all can agree and know that COVID-19 has really altered the way we see our normal life through changes in our employment, lifestyles, and likely a lot to do with our health behaviors. And there is a good possibility that social media may be playing a role in shaping our beliefs and behaviors as they relate to COVID-19, how we perceive COVID-19, whether or not we engaged in COVID-19 preventative behaviors such as wearing a mask, getting a vaccination, which may have in turn also impacted individuals' health and life. So we asked two different questions on, well, one, we wanted to know if we just ask people out front without giving them a prompt or response options, what would they say were the impacts of COVID-19 on their health and health behaviors? And we were also interested in what sources of information they were using for COVID-19 and if they had thoughts about using social media for information on COVID-19. So really the purpose of this study, this was a smaller study that we did to actually inform a larger survey that we just started analyzing the data on, but looking at how people reported effects of COVID-19 on their health behavior, and then their trust in different sources. We also, like the last study, used a Qualtrics survey, and we also used Qualtrics panels to collect the data in December 2020, just to give you context, as beliefs have changed over time related to COVID. But we got a sample of about 103. We used quota sampling to match up some of the demographics with the United States. And this was mostly a qualitative study in that they were open-ended questions that asked individuals in general, how has COVID impacted your health? How has it impacted your engagement in different behaviors related to health? And we generally also asked them about their beliefs about COVID, where they get information about COVID, and their beliefs about social media and COVID-19. And then we had some closed-ended questions that were just related to demographics. And we did a thematic analysis of those qualitative analysis, or I should say my students did that very well. And we did calculate some frequencies as well. So I want to take you through, just to give you demographics. Again, it was just a sample of 103, so it's smaller, but it was across the United States. And we had an almost equal split male, female, and our race ethnicity matched up in terms of the percentage for the general US population because we did use quota sampling. But I would note that most of our participants had above a high school education, so about 74% did. And I did want to mention, because we did look at political affiliation differences and some of the things that came up, that we had about 31% that identified as Republican, but a higher number that identified as Democratic, about 46%, and then about 17% that identified as independent in terms of their political affiliation. So in the first question, we asked people to just tell us, how has COVID impacted your health? And what was kind of interesting is a lot of people said it didn't at all. That was about 48% just said it didn't have any effect on my health or didn't affect me. But I will note that there were some people that said, well, it didn't affect me, but it might have affected other people or my family members that are at higher risk. We did see almost 30% in some way or form brought up that it impacted their mental health in a negative way. So that was one of the main negative parts that people brought up. In general, we asked about their health. In terms of health behaviors, it was interesting because we did see a lot of people who would say, my physical activity has decreased, and we saw a few people talk about it impacting their ability to go to the doctor or not eating as well. But then we saw people who said it was actually good for their health behaviors. So for example, we saw an individual talk about, I've actually had more time to exercise since COVID-19 has started. So it's both positive and negative effects in terms of health behaviors. In terms of trust in sources, we did, before asking them about social media, we wanted to just know who do they trust for health information. And the top one that came up was TV. And this could just generally them saying television or a news station. We saw individuals talk about national news stations like CNN or local news stations. And then the second most common was governmental sources. What was interesting is very few people said that a healthcare provider or social media, which I don't know if that was surprising, but the healthcare provider one was a little bit more surprising to us. And I will mention that we did categorize these and look at differences between political parties. And in general, there wasn't any difference between those who said TV, between the different political parties, but we saw a lower percent of Republicans listing government sources and healthcare providers as a trusted source for COVID information compared to Democrats and independents. In terms of social media beliefs, we asked them generally, what are your thoughts about social media during COVID-19? We wanted to see general thoughts overall about social media. There were some positive that people thought, oh, it can help us support or it's useful in getting information. However, I would say there was a more negative aspects about social media. We saw almost 40% in some way mention that social media is not trustworthy. And some even believe that it can be harmful when it comes to COVID-19. And we also did ask individuals how they could tell if information about COVID was real on social media or accurate. And many people said you just can't. There isn't a way to tell if it is accurate or not. So overall, there seemed to be a lack of trust for social media when it came to COVID-19 information. I did want to bring up that we just generally asked about COVID-19 beliefs. And it really varied across. There's people who thought it was real, it was scary, they were worried about it getting worse. But at the same time, we saw individuals say that it's overblown, it's over-exaggerated. We even saw people say that they didn't believe it was real. And we did see a higher percentage of Democrats talk about COVID-19 as being real and threatening versus Republicans. And more Republicans in general mentioned that COVID information is not reliable. So those are overall what we found that we thought were really interesting in the qualitative results. I want to mention that we collected this data in December and things have definitely probably changed when it comes to our information about it. And we collected this data once, we didn't track it over time, and it wasn't a random sample, even if it was national data. In terms of next steps, we are really excited because we did use all of these qualitative responses to create a larger survey, and we used a lot of those to create response options. So we just collected data from over 500 adults across the US, and we're currently analyzing it. And now we're actually looking at those relationships between COVID-19 behaviors like getting vaccinated, wearing a mask before and after getting vaccinated, and how that related to different demographics, trust in other sources, and their general COVID-19 beliefs. And with our same thing as our previous presentation, we also received funding from the Center for Expressive Technologies and Center for Health Research. And if you don't know that, they actually have their application open again if you want some seed funding related to one of their topics. It's actually closing tomorrow. And that's all I have, is if anyone has any questions.
Great. Thank you very much for another really interesting and enlightening presentation. So we have 4 minutes, I think. Yeah, 4 minutes to take questions. On that. I'm not seeing anything in the chat. Or yes, Denise.
Yeah, so sorry, I wasn't typing fast enough to get it in the chat. But I was really struck by your comment around social media and people feeling like they don't trust it that much, but we know it has incredible influence on the ways in which people think about political and social issues. So I wonder if you think people differentiate between messages they think they're receiving from social media versus messages they feel like they're receiving from a friend or a trusted group or source that were the folks who posted to them on social media?
Yeah, I would say that we have asked about that specific, like if it was who was actually the source of that information. And I would say that both of them were actually kind of untrusted in terms of what we saw with COVID-19, that they were ranked really low if it came from a friend or a family versus general social media. Yeah, I feel like there's a lot of distrust in general about COVID-19. And even like what was interesting in the larger survey, they were even distrustful of healthcare providers, which is not common that we found. So I think there's a general distrust around COVID-19 information if it's from social media and not regarding who it's from in general, which a little bit alarming from public health and how we try to convince people to do things, especially if we're going to use social media.
Thank you.
I had one comment on that you were surprised that the healthcare, advice from healthcare was ranked not very common. But I also know that we were all discouraged from going to our healthcare providers during COVID. It's like, make a phone call, do something else. So in a way, I think it is kind of interesting that a lot of there was reduced potential interaction, I think, for many people with their healthcare. It was recommended you don't come to the doctor's office unless you really, really need to. So anyways, any thoughts on that?
Yeah, we actually did look at in the larger surveys, we could look at that if they did see a decrease in their access to healthcare provider and how that related to what sources they trusted. But yeah, and it's really interesting just in general, because we didn't ask about access, we just said, who would you trust and which sources would you trust? And healthcare providers were just not as high as what I've seen personally with other surveys when I'm asking about trust in health information. But definitely something I can explore. So thank you.
Yeah. Any other comments? I had one more on the kind of distrust of some of the government, and maybe I misinterpreted this, but like from the CDC. But I think there was a little confusion from the CDC. So I can't remember at what time frame that was in relationship to your survey, but because I know for me personally, I always trusted the CDC, but then it seemed like we were getting some, and we found out potentially politics were interfering with some of the messages. So I can kind of sympathize with the challenge for that.
Yeah, we did generally we did categorize it into government sources, which came up as the second most common, but that we did see people who did specifically bring up the CDC, but they may have also just said like their local health department or their state as well. And I think both, even with the healthcare providers, this is the issue of uncertainty that we didn't know yet, and we were just going based on what we knew. And I think that led or possibly led to distrust in those sources.
And confusion. Yeah.